Hi, like Marla said, my name is Kim Van Camp. I have my Master's of Science in Gerontology, and I received that from the University of Missouri St. Louis a few years ago, so I'm an old student. But I'd always wanted to go back to school and get into something else, and geriatrics was my calling. So then I was hired by the Alzheimer's Association. So I'm here to tell you about what services and resources that we offer. So is anybody aware of who we are? Have you heard of us? Are you aware of the Alzheimer's Association? Okay, yeah. So we are a nonprofit organization. We have 77 chapters across the United States. Hi. 77 chapters across the United States. All of our services and resources are free to anyone. So we're just going to go through those. So I have no interest or stocks in pharmaceutical companies. And then the learning objectives today are we're going to go over the facts and figures. Those come out by the Alzheimer's Association every year. We're going to talk about the challenges in diagnosing, and you've probably come across a lot of these challenges with families. And then resources that the Alzheimer's Association offers to families living with dementia. So before we start, I just wanted to tell you a little story about a couple of ladies. They were excited, and they're talking about the upcoming dance to the country club that they're going to go to. And one lady, Mrs. Jones, said that she had heard that they were supposed to match their dress with the color of their husband's hair. So she decided that she was going to wear a black dress. Mrs. Smith said, "Oh my, I guess I shouldn't go." Okay, you got it. All right, so have to break the ice a little bit. So the Alzheimer's Association mission is to eliminate Alzheimer's disease through the advancement of research, provide and enhance care and support for all those affected. So it's just not that person with dementia that's affected, it's also those family members and those care providers. For every one person that has dementia, it's proposed that there are 3 care providers that take care of them. We also want to reduce the risk of dementia through promotion of brain health. And then our vision is a world without Alzheimer's disease. We all want to see that happen. Alzheimer's is on the rise, so the time is now to really get energized and get people connected. Sadly, we are only seeing or reaching about 5% of those folks that are affected by dementia. Right now, there are 5 million people affected, less are diagnosed, and then we're even reaching a smaller population. So that's why I'm here, and that's why my goal as Healthcare Initiatives Coordinator is to go out and talk to healthcare professionals, social workers, anyone that comes into contact with families affected by dementia to help them get connected with the Alzheimer's Association. And then our big push over the next 10 years is to serve 80% of those families. So we can't do that without other folks helping us get connected. So facts and figures, again, these come out every year by the Alzheimer's Association. The Alzheimer's disease is the 6th leading cause of death in the United States. It's the only cause of death, I'm sure that all of you know, that can't be prevented, cured, or slowed at this time. 1 in 3 seniors dies with Alzheimer's disease or another dementia. And I know it's always interesting when I'm out in the community, people are like, "Oh, my mom has dementia, it's not Alzheimer's disease, so that's okay." So they don't understand that differentiation. 2/3 of Americans with Alzheimer's disease are women. And then this is a projected how Alzheimer's disease is going to affect America. So as you can see, like Alaska, Wyoming, all of the western states have a higher increase. I think it's because I'm one of those people that want to move west as soon as I retire. Florida is not as high. But then the middle states have a lower projected increase of dementia over the next few years. So the increases, and a few years ago this was every 68 seconds someone was diagnosed, and now it's every 67 seconds. And again, this comes out every year. And then by 2050 it's projected that it will be every 33 seconds someone is diagnosed with dementia. So of course it's causing a strain on the U.S. economy. Right now it's $226 billion, and by 2050 it will be $1.1 trillion. So this is going to break the United States. Research, you know, is heavily underfunded. There was an additional $30 million that the NIH pushed toward research this year, but it's still underfunded. So the United States government is the top funder of research. The Republic of China is the number 2 funder of research, and then Alzheimer's Association is the number 3 funder of research. So that's why we have all those walks, and we ask you to come to events and do all that fun stuff. So Alzheimer's deaths continue to increase. You can see the first one here is breast cancer. It's went down a lot. There was a lot of research funding. A lot of people are getting cured and detected earlier. Heart disease is going down, prostate cancer, strokes, HIV. We all remember the AIDS, or most of us in the room. But Alzheimer's disease is up 71%. So what could happen if Alzheimer's disease could be delayed? So of course we would say families, that devastation of paying out money, trying to work and take care of their own children, take care of mom and dad, work. It's just a huge struggle. We would not break American budget. So we really need to work on pushing forward for research and a cure or a prevention for Alzheimer's disease. So diagnosing dementia. So what issues do you see? So I'm always learning from healthcare providers as well. So what struggles do you see when a family comes in with diagnosing? Do they talk about it? Do they sneak and say, they call ahead and say there's something wrong? Yeah, I hear a lot of different things that happen. So this came out just this year too. So only 45% of folks with dementia are being told, are being diagnosed. And more than 90% of those people with cancer are told of their diagnosis. So those numbers really need to change, where people, again, we need to stop the stigma and talk about dementia or memory loss. So diagnostic challenges. So there's a lack of definitive tests. So here I'm sure you used SLUM and other diagnostic tools, but there's not, when I go out into rural communities, urban communities, they use the mini mental status exam. So folks are still using that. And when I say you have to pay to use that, they're shocked. They're not aware of that. There's lack of communication between patients and caregivers. We see those families that come into us all the time, those couples that, the wife is covering for the husband's covering for the wife. They just don't want to talk about what's going on at home. A lot of folks have said that they were aware that there was a problem, but they just didn't bring it up. Do you have a lot of time for questions? I'm sure time is a problem with really digging deeper and finding out what the issue is. And then patient and family denial, that's 65%. So most people don't want to talk about it. They deny that there's a problem. And then it's also the social stigma. So this is interesting. So here's Alzheimer's disease, the first one, 45%. And then we go over to the 4 most common cancers. So it's breast, colorectal, lung, and prostate cancer. And then 96% of folks are told that they have breast cancer. So again, all of those top diseases are told, but Alzheimer's disease is not. So why are there such disclosure rates? Again, it's fear causing emotional distress. Again, we see a lot of folks, we get referral forms, and I have them in your packet, and we'll go over those in a minute. But a lot of times it says dementia. That's a diagnosis, it's dementia. It's not anything else, it's dementia. So it's fear causing that emotional stress to the family. We don't want to tell them what's going on. Diagnostic uncertainty. Still, you guys are the pros, you know what's going on, but a lot of people out there in the field, a lot of physicians, they're not sure what's happening and they don't want to diagnose. Time constraints. How long do you get with the patient every day? I heard 17 minutes. I don't know. Oh, I'm sorry. Is that way a lot? Is that too high?
Way too high.
Way too high. 7? Is that more like it?
We get lots more than 17 minutes.
Okay. So time constraints, lack of support. So when you diagnose someone with dementia, where do they go? What do they do? So it's like, okay, you have dementia or you have Alzheimer's disease, and here, go on with your life. I know, I visit a lot of rural communities, and I was in Warrington one day, and I stopped in a physician's office, and I was explaining we had a support group in the area that they weren't aware of. And that's the thing that she was most excited about. And I said, well, can I ask you, what happens when someone's diagnosed with dementia or Alzheimer's disease? And she goes, oh, the family takes care of it. And I was like, oh my goodness, we offer so many supports and resources. And even though we may not have as many services in Warrington, there's still a call that they can make, and they can get that online support or phone support. Communication difficulties, patient or caregiver wishes. Again, don't tell mom she has dementia. We don't talk about it. And then the stigma.
Can I just bring something up?
Yes.
You're talking about Alzheimer's as if most dementia is Alzheimer's. The data to support this is minuscule, except in the minds of people at Washington University.
Okay.
I mean, realistically, if I go to Japan, they'll tell me that a third to a half is hypertension and vascular. If I go to Italy, I get the same sort of thing. The patients I see, the vast majority, I cannot say they've got Alzheimer's.
That's fine. I'm the one that sends you one that says dementia when you said that.
Yeah.
I really always just say dementia.
Yeah, I mean, the problem,
I
and I understand the need to sell Alzheimer's disease, particularly from its association. It's one word, it sounds great, but I think it does a disservice when you talk to professionals, because that means they immediately throw away all the treatable causes, and there are a ton of treatable causes. There's also relatively reasonable data that says that if you do good lifestyle changes, you're going to make a difference. And I think we've got to be a little careful in saying, and I understand why you do it, but it really, the only person I know who truly believes that is John Morris, okay? But John Morris gets huge amounts of money to sell Alzheimer's disease. I don't get huge amounts of money to do that. I get large amounts of money to sell people with cognitive dysfunction who we can fix and we can make better. And I do think you can slow down Alzheimer's disease. I think the data is relatively good at this stage for the lifestyle changes, the Mediterranean diet, exercise and stuff. Certainly the IAGG consensus, despite John being on it, said that you could do this, though he didn't actually agree, but the rest of us, and he was on it, agreed that it was possible. I think it's very important to understand that, particularly for physicians, because if you teach everybody it's Alzheimer's disease and there's nothing that can be done, you miss the sleep apneas. I mean, we get patients at least once a month who've got seen up the road by the people at WashU who have a treatable cause of Alzheimer's. And they totally miss it because they're so convinced it's Alzheimer's. And that's what happens. And I think it's very important to say there are a lot of things that can be done. Yes, for getting money for research, which we need, and I'm not arguing, you need to sell it this way. But when we're looking at the individual patient, I don't want to tell the individual patient that there's nothing I can do. There's a lot I can do, starting with just getting the advanced directive stuff. You know, there are things that can be done, and those need to be done first. So, I've been around the Alzheimer's Association for a long time. It used to be Alzheimer's Association and related diseases, disorders, and that part seems to have totally disappeared. And, at least for my faculty, I hope that they will think a little beyond that everything is Alzheimer's. And I hope the Alzheimer's Association doesn't believe what you've been saying, because it's not right.
Yeah, well, and when I go out and talk to communities, I do talk about those other dementias, and that there are some reversible dementias and things like that.
I mean, vascular dementia is a great example, and we see a lot of vascular dementia. It's just that people got tired of calling it vascular dementia, and most vascular dementia eventually will become Alzheimer's, and that's what happens. But when it's vascular dementia, if you treat the high blood pressure, you treat the atrial fibrillation, you treat these things, you will slow down from becoming Alzheimer's. And we're clinicians, not salespeople.
Yeah.
So I know you're trying to sell, and it's your job.
I don't like to sell. No, I don't like to sell.
Well, it's your job, to some extent. It's like my job to sell education. We do the same things.
What happens a lot of the time is it's not that people don't know there's a problem, right? And they will go to the PCP, who also knows it's a problem. And so by the time they come, they've already been taking Aricept for a year. And the conversation is usually, oh, well, we know that she's got dementia, but at least it's not Alzheimer's disease. I said, oh, really? How do you know that? And there is a differential diagnosis. You're not going to go do a brain biopsy anymore. When I was in medical school, it was a diagnosis made by brain biopsy. I said, oh, this is an extremely rare disease. And they were doing brain biopsies. which is kind of pointless.
But I guess
It makes a difference what it is. I mean, if among other things is like why do they do tumor markers on people with cancer? Because some of them are familial. Some of the dementias are familial. And so you do want to make a differential diagnosis. And if they say, oh, at least it's not Alzheimer's, that's misinformation.
And there are over 120 known causes of dementia. So to call it Alzheimer's because we never look at Fragile X and how many people get diagnosed with Fragile X. It's not a totally uncommon condition in older people.
There's a whole pocket of Pick's disease over there on the other side of the river in the was it Marion County?
Really?
And there's only 2 last names. And I see 4 or 5 Picks in my clinic every year.
And we see a lot of Lewy body, if you believe the Mayo Clinic is supposed to want you, it's about 20 to 30% of the dementia population. I mean, that's the problem, and I think people really need to be aware of that because, first of all, to say to someone you've got Alzheimer's, because you guys have done such a good job at selling that it's not a good disease to have, which it isn't, people get all upset. And so it's sometimes nicer to say, well, you've got a dementia, I don't know for sure, even if I know or I think it's Alzheimer's, and if I don't do at least a PET scan to look for the amyloid, I really can't diagnose it.
But I don't really need to do a PET scan.
And it's very expensive
to
to do
change
all
what
that.
I'm going to do.
But it doesn't, I mean, from my understanding, from learning through the Alzheimer's Association, it takes years to really diagnose someone.
You've got to follow them, and it's like the WashU Alzheimer's ADA. It's not diagnosing Alzheimer's, it's diagnosing dementia. And then people use it and say, well, you've got Alzheimer's. You don't, you have dementia. And I think that's what we have to be very careful about, because even the Alzheimer's disease that I see is multiple different diseases. I mean, you've seen enough Alzheimer's to know that it can be anything from people whose behavior is totally crazy to people who are just normal and nice. And I think we make a big mistake when we clump together at least the academic level, and hopefully we'll be able to teach physicians to do a better job with the stuff that we're doing and get to the stage where they can at least get rid of the treatable and the different kinds. And if you can do that, then you can most probably make a bigger impact on treating the true Alzheimer's. If you're treating a Lewy body dementia as an Alzheimer's, it's most probably not going to get better. And that's the problem. I mean, I understand where you're coming from totally. I understand why the Alzheimer's Association did it, but this is why I stopped becoming a member of the Alzheimer's Association 20-odd years ago, because you guys got so carried away with wanting to get money for research and stuff without doing stuff. And you do great stuff in the caregiver stuff and stuff like that, which I really appreciate. And I do send money anonymously, because I will never let you know that I sent money to you because of those things. Okay, but I know how important.
No, but I greatly appreciate, the feedback. I really do.
On the other hand, the Alzheimer's Association will provide services to people who have Lewy body dementia.
Yeah, when you start.
Oh, no, your services are
don't have to come
wonderful.
with
You
a
should be
letter
selling
from
your
the doctor.
services for demented people, and you should not cut back on them under any circumstances. And I know recently you've got a new boss who thinks raising money may be a little more useful. I know you don't believe this, it's just me who believes it, okay? I'm giving you a bad time.
I'm going to move on.
Okay. I'll shut up, okay?
All right, John, you've been talking for 20 minutes.
So the Medicare annual wellness visit, is everyone aware of this? That Medicare annual wellness visit, you can get a cognitive screening. And I put this on here, this wonderful tool that can be used now, and I'm sure you guys could probably teach this better than I can. It was developed here, the rapid screening program.
That's really nice. Now, you should have shown
I know,
that before I opened my mouth. I couldn't feel anything on
Now you
that.
feel that, that's okay.
Go on.
I love to learn. And I don't know if you're aware of this Alzheimer's disease Pocketcard. So it's a phone app that you can download on your phone. The one thing I really like about this is it's got screening tools on there, but also it's got information packets. So if you do have a patient in the clinic that says, you know, mom is wandering or dad isn't showering, there's information on here that you can directly email to the patient or you can print out and hand it to them. Okay, on average, how long does it take someone, if you said, call the Alzheimer's Association today, they can help you with resources and services and no charge to you, how long would it take someone to call us, on average?
So if they tell them
6
4
months
times
to
a
a
year.
year.
How long?
6 months to a year.
6 months to a year, longer.
But it depends how many times you tell them.
That's true.
If you don't tell them every time you see them, it doesn't.
Okay, well, there was a study done on this, so 2 years, yeah.
Yeah,
About 25 months, yeah.
yeah.
So, and that's why families are reluctant because of the stigma and that, or like you said, it's like they were told once, they're handed a piece of paper with a number, they don't call us. And they're unaware of what we are and what we do. So early detection, what can you do? So make a referral. So in your handy-dandy packet here, there's a rapid referral form. And what it is the client or your patient fills out the top portion of it. And then you can sign off on the bottom for dementia. Thank you. And then we call them. So we call them within 2 weeks. So instead of taking that 2 years, we call them in 2 weeks. Some people don't want to talk to us. They're like, we're fine, we don't have any problems. But at least they reach out and they get that phone call. And then after that, they'll follow up 3 or 4 times over the next year. And eventually we try to get them into our office or over the phone to do a care consultation, which is also a free service. It's with a licensed clinical social worker. He finds out what's going on, what do they need, what services or resources do they need, do they need to get with legal counsel, so what plans do they have for the future. So 2 years ago, there were 44 referrals. Last year, I went out and knocked on doors and talked to people. So there were 258 last year. So it was a lot more families that we were able to help get those resources and services to them. So manage memory loss. What do? We have care consultations, safety services. So we talk about driving. We talk about wandering. Respite assistance. Are you aware of the respite dollars? Okay, so for people that aren't, the state of Missouri allots the Alzheimer's Association $450,000 a year. So I always tell everybody it's your tax dollars. You fill out one application, and you have to have a physician sign off on it with a diagnosis. You fax it to us or get it back to us, and then it's up to $500 per year for 2 years. And I brought brochures about that too. There's always a little bit of a wait list, but if you do have an urgent case or an emergency, we have funds to help with that as well. But they can use it for respite, they can use it for products, some people have used it for medication, so it's a little loose on what the folks can use it for. Yes?
I'm just curious, since it's Missouri-wide, do you have a sense of who's using the most, like Kansas City, Cape Girardeau? Is it
I don't have those numbers. We go through all of our money. I know we use a lot here in St. Louis proper.
You get dedicated.
Yeah, and then but I know sometimes like last year it came through really late in the year, so we had used all ours, so we pulled out another bucket because we had so many people on the wait list. So yeah, so if the Columbia office doesn't use it, then we can pull. We're really trying to get out more to those rural communities as well. We're trying to really
Cape
push
Girardeau
them.
is part of you, right?
Yes.
Yeah,
Cape
so
Girardeau.
this area is all one, and then there's Columbia, and there's Kansas City.
Yeah.
There you are, thank you.
Yeah, so we have, you're just ahead of me all the way around.
Oh,
Yeah, so we have up to Bowling Green, Pike County, down to the Boot Hill, over to Rolla, and then it's like that 4061 corridor through Illinois. So we go over like to Effingham, over in Illinois. So it's 38 counties, it's a big area. Education programs, support programs, we have support groups all over our 38 counties. Early stage programs, I love the early stage programs, and I'll go over those. Faith outreach initiative, we have folks in the churches that help connect families. We have volunteers, we have over 1,200 volunteers that help us to do what we do. Trial match, research funding, and donations that Dr. Morley sends in anonymously. So for a 24/7 helpline, we always try to call it a helpline, not a hotline, so we don't want
Did
people
you have the safe return on this?
I'm sorry?
The safe return bracelet.
Yeah, I'm going to go over that too.
It's covered.
Okay. Yeah, I'm going to get
I
there.
thought it was one of your services.
It
I
is.
didn't see it on the list.
So the 24/7 helpline is for professionals and families, for anybody. When our office is open Monday through Friday, 8 to 4, the call are answered by our helpline specialists. They've been care providers, some are social workers, but it's a group of different folks. When our office is closed, all those calls are routed up to Chicago, and everyone in that call center is a licensed clinical social worker. And then what happens if someone calls at night, then we get an email the next day, and that phone call is followed up with someone locally. And they seem to like that local connection. Serves over 250,000 callers a year. They can have 170 different languages and dialects. So if you have someone that you can't connect with, we probably can. And then I know you guys have 32 minutes that you can talk to somebody about mom not showering, right? So average call is 32 minutes. So that's why we say call them, have us call them, or you have your patient call us. Again, support groups, they have men-only groups. The men-only groups really got so large in our St. Louis office that we have one in St. Peters now and one in Chesterfield. There's adult children only, and then there's a new program that's starting. It's 4 weeks. It's living with Alzheimer's. So it's the person with dementia and the care partner that come in together, and they just talk about they kind of get information about what it's like to live with Alzheimer's disease. And then care consultation. Again, he goes over just what do you need, what's going on, take care of yourself as a caregiver, and then what's the future hold for you. Education, we have e-learning courses, so if you have anybody that wants basic education about what is Alzheimer's disease, they can go online. Talks about the basics. Healthier Habits for a Healthier You is a new one, so we talk about the Mediterranean diet and exercise and heart healthy, so that's a new program that we're offering. And then Living with Alzheimer's for Caregivers, so how do you take care of yourself as a care provider? And then for care professionals, so for those that are working day to day, we have different online or Zoe Deering. I don't know how many of you know Zoe Deering. She does the professional education in this area. There we go. I was trying to hurry to get to this. So the Medical Alert Safe Return Bracelet. So it's $55 a year for the person with dementia, $35 for the care partner. But what happens on the back, there's a phone number that they call when this person is lost, and then it directs it to the Alzheimer's Association. We have all that person's data and information online, and we help call the media and the first responders and get people moving to help get this person found. And then there is some funding available if you have anybody that can't afford the $55. We do have scholarships available for that as well. It'll pay for the patient, but not the care provider. And then again, the respite funds. Early stage programs, Cardinal Reminiscence League. So that is now, we were doing that in our office, and now we have toolkits for people to do that out in the communities. Living with Alzheimer's, again, is the new program. It's 4 weeks. Let's Talk. That's where someone with dementia, there's a group of them that come into our office on Saturday mornings, and they call folks out in the community. So people with dementia have that connection with someone else that has dementia. They don't think they're the only one out there. And then Meetup Groups is a great new program that started a couple years ago. And these people meet up, and they go to Kissinger's Chocolates, and they go to museums, or they create art. So they really get out, and the people with dementia and those care partners do social events, so they get that socialization. So on the web, we have our Care and Conquer coming up, and I have postcards about that. And it's a big event that we do every year. But we just have anything that you need to know or want to know about any dementia. You can look up Lewy body, and you can look up the different dementias on our website. And then Community Resource Finder. So does anybody remember the list that we used to have of every county and what was available in that county? And we had all these lists. We've converted that to an online source. So CareLife manages this for us. Physicians aren't on here yet, but they're hoping to get that on in the next 6 months to a year. But someone can go on here, type in their zip code, a patient, and then they can find what resources and services are available in their area. And that's all. That's it. So what questions do you have? Yes.
I'm doing one of the Care and Conquer lectures, and
Awesome.
I have been looking on the website to sort of refresh myself, and I noticed there is assisted living facilities listed, and I can't tell you how many times people come in and say, you know, what are some assisted living facilities, and I can never remember. I can think of like the three that we know of, and then, so I think that's a really good resource that I forgot about or didn't know about, you know, and there's also nursing homes on there if families ever want a list, which is, they always do, and I'm always like, I can tell you the ones SLU goes to, and I'll tell you about them, but.
Well, thank you. And then, and I know for those older adults who don't surf the web, they can still call us, and somebody in our office can look that up and print it off for them and mail it to
There is a list of geriatricians on there, but it's like the only ones on there can't make it poorly. From our
okay.
They don't.
There are people who are
That, Angela, is
looking
most probably your fault because you
dementia
haven't
care.
told them. How about that? For once we'll exonerate the Alzheimer's
Sometimes they need
Association.
residential
Okay.
care. Is there any way to, or is there any single resource for finding things that at least are billing themselves as dementia care, and any way of rating the quality? Because at least as far as I can see, any place that has the appropriate license can call themselves that, but it doesn't mean they have any idea
Right.
that they know what they're doing.
You're right. That's a great question. I don't know. I'll have to find that out.
So
Is
there any way
is there any
of
for the memory care like
certified
they just make themselves
memory care
There's no
programs or
certification.
memory care,
I mean, I think they have to
residential
get all the
care?
appropriate facility accreditation.
They call themselves that, but I know of
They don't really do
no
memory.
certification.
I don't think so.
Even the ones that call themselves certified, I don't know who it is they're saying
Well, I
is
think
certifying them.
I think they're just certified by, you know, the state.
With assisted living certified, the memory.
Right. You know, they have the appropriate accreditation to be a residential
Who is
facility.
accrediting them based on what?
Assisted care living state actually does the same thing as nursing homes, but
Right.
it's much bit differently.
Yes,
So
but that's not
for
the
the
same
memory.
thing
There
as
is a
dementia.
memory care organization, so it's a little bit like Eden Alternative. We can't use Eden Alternative at Maryland Heights, even though we do all the animals and everything else, and much more than other people, because Thomas copyrighted it, and basically, like falsely, it costs you money to say you're an Eden Alternative. So there's a society of memory care that you can become a member of.
Yes, you just pay,
You pay and you
pay
get
your
it.
membership. and
It's
you
like
get a
Jacob
sticker
from the
to put on
hospital,
the
same
wall.
idea. Okay. You know how the
Okay.
hospitals get accredited? You
They
pay money
they
and
pay Jacob.
they accredit you.
So you can be a certified dementia care manager.
Yeah, who certifies you?
That is by the National
Association of.
Some people who are
NCCDP is that.
No, I mean, this is the problem. I mean, there are all sorts of certifications out there. It would be actually really helpful if the Alzheimer's Association created their own certification for these sort of things and had criteria, because, you know,
Well, and with the let me see, with the professional training, it's a certification that
Yeah.
Zoe does, yeah, the Foundations of Dementia Care, so it's a paid.
It's the National Council of Certified Dementia Practitioners.
Who?
that's like the American.
What does that mean?
I'm just reading.
What do they mean
It's
by
like the American
practitioner?
Geriatric Society. I would say it's like AMDA as well, but I don't want to get carried away. You know, I prefer AMDA.
What do they mean by practitioner?
Whatever you want. Now, we understand it's a problem, but I think that's something maybe to take back to the Alzheimer's, because it would be really good if there was some good certification criteria. The same thing for special needs units, you know, in the nursing homes, because anybody who has a locked unit says, I've got a special needs unit, they may have absolutely nothing in the unit. And I think,
No, they just have a lock on the outside.
and the same
They
thing,
call it that, yeah, the mark.
you could also certify hospitals that could actually look after people with Alzheimer's. That may be very hard to find any, but that's a
You
separate
can
thing.
call yourself an ACE unit.
Yeah, I can certify it if I wanted. I just
Yeah.
create a new society. No, I mean, but I think to some extent, this is where the Alzheimer's could make a huge difference, is by certifying these fly-by-night places that are, and I mean, you know, the Dolan memory units are very good. I'm not telling you they're not, but there are lots of people who call themselves memory units. And
well, there's many people that call us and we tell them the cost of the class and they say, never mind.
Yeah.
Yeah.
How
So
much is it?
Well, they say it's like $300 or $400 per person. I don't know. I mean, I know that's a different. I'm a silo. I do my job, so I know there's other. Yeah, I could find out though. I mean, if you want information on that. But I know Zoe travels all over and she does a lot of classes. But she's a busy woman.
So the Joint Commission has memory care accreditation requirements and optional memory care certification for nursing care facilities.
So that's nursing homes, not assisted living. That's why
Correct.
most of them are in assisted living.
Correct.
Where actually they're legally not supposed to be, because if you've got dementia, you can't find your way out, and therefore you don't make the criteria to be an assisted living.
So this was effective July 1st of 14. So it hasn't obviously been.
You can,
So they ought to have a list of places that are JACO certified.
Let's see if we can do it.
other places beside there.
So if anyone's interested, yes, Lynn, your question.
I just downloaded the app, but
Okay.
my quandary always is I'm always telling people to sign up, but the Office for IC patients, they don't allow us to keep forms there
Okay.
because they're not the hospital-based forms, and I can't carry around every form that I went to.
I understand.
With me. So I don't ever fill out this referral form.
Okay.
And I see that there's not something on the website to actually do that, or on the app.
Download.
Is that a possibility where they're going to do that? Because it would
I'm
be,
hoping.
I mean, because
there's
there's that
not-
while I'm sitting there with the patient to just say, hey, right now I'm referring you to the Alzheimer's Association, so you don't even have to worry about it.
Yeah.
So they won't let us keep them in the drawer there? We keep like all those other secret forms
Yeah, they
in this
will.
drawer?
Yeah,
The
secret
secret forms are always.
They're like not allowed in the chart.
I like to be able to walk out and say, I need an Alzheimer's referral,
Yeah.
and for them to be able to help me fill that out. But
No,
that doesn't happen.
but-
I can do it
But
when
there
I'm
is a
there.
secret referral drawer. We have all sorts
There
of
is.
things we're sticking in
It's
there.
not in there.
Hmm?
Have you gone through all
These are
the
in there.
drawers?
No, it's not there. But,
The drivers, the referral forms.
I print out the driver thing every time.
yeah, we print a lot of them out, but the
The
Alzheimer's, you're right,
handicap
we
one is
can't
not
print
in
out,
there.
so you.
I print out
it
that
doesn't
one,
get
too.
out.
I can email it to you so you can print it out.
Yeah, we can keep it in our secret
There
drawer.
you go.
I want it to be electronic. I don't want to.
Yeah, and I know. I mean, if you're, I can
Because I
email
don't
you an
think that they're
electronic
gonna
form
fax
Being
anyway.
on the
No, they
computer
won't.
would be a
You're right. I know. And we're trying, I mean, and not all of the associations are doing physician outreach.
Give less money for research and more money for forms on the computer.
Yeah, there you go.
That's my personal opinion.
Yeah, I wanna be
Okay,
able
I
to
do
do it.
Alzheimer's research, so
Yeah.
don't look at me as if I really
I'm
do.
not.
I
I
wanna
just
do it
think
through
that
the
those are the important.
Yeah, I know, and that
things
would
to
be
do.
wonderful. And hopefully they
Because
will
it's
come up with
otherwise
that.
pretty interactive.
Well, I was going to say, if anybody wants to come to the Care and Conquer event, you can have a pass to come in. The one in St. Louis, Dr. Ron Peterson will be there. He's the one that diagnosed Ronald Reagan. So that's at the Jewish Community Center on Monday, November 23rd, the Monday before.
How'd you get me for St. Charles? I haven't done anything.
Yeah.
You got the one that diagnosed Ronald
Ah,
That's
Reagan.
okay.
You got
St.
me.
Charles is awesome.
They-
I'll be
they-
at St.
they-
Charles.
somewhere else.
John,
Okay.
6
Years after, it was perfectly obvious to the
Yeah.
professionals.
Yeah. But Ron Peterson is actually famous for mild cognitive impairment. He most probably did more work along with Barry Ross, are the two people who really put mild cognitive impairment on.
I'm saying it's the St. Charles crowd's getting gypped.
And that's what he does
No, they're
really
not.
well. Alzheimer's, he's not nearly as good at Alzheimer's as he is at MCI. If I was sick with MCI, I'd go to
He had a diagnosable Alzheimer's moment. They had to cut to a commercial. There was no question.
I think most of us diagnosed Ronald Reagan before any physician diagnosed him. I think my wife was way ahead of me in diagnosing him.
But we just ask that you RSVP. But St. Charles is on here as well. And I'll be at that one. That one's, when is that one? That's the 7th of November. Thank you. Yeah. So there's information. What other questions do you have? Is there anything we can do other than getting people trained?
I think importantly, we've got two residents here, and, really understanding that any patient you see who's got memory
Memory loss.
problems, forget Alzheimer's, just call it memory problems.
Yeah.
Put them in contact with the Alzheimer's, and every time you see them, ask if they've got their safe return bracelet. If you can't see it, make sure that they have contacted Alzheimer's Association, because otherwise you're not going to be able to answer the question. And they can answer many questions that I can't answer for the patients. And that really is a tremendous service. But it takes telling the caregiver 5 or 6 times, truthfully, you just got to keep on until they do it, you know.
Yeah. And I think, what we hear is they're just overwhelmed, so it's one more thing they have to do. And that's why it's the referral that really take that pressure off of them.
But if you put it as your major thing when you see somebody, it makes a big difference.
Affleck. Anything else? But the coupons will get you in free for the residents, the students, the coupons, it's free, it's $5. And there'll be snacks and food there. Oh, I know, for college students, so. What else? And who are you, I'm sorry. I was trying to see who you were. I didn't see your name. And you send me direct connects, don't you? I know your name, thank you. And what's your name? I'm sorry.
Sanford, Angela Sanford.
Okay, yeah, you do too. I know names when they come through. They kind of took that off my plate, so I don't enter them in the data anymore. But is there anything about, what our goal is to really reach people as early as possible.
Where can I get one of the forms? So I could just have her
And your pass. Oh, I can email it to you.
I would definitely refer
Yeah,
that.
because then you can
I'm
just
thinking of
sit
patients
here
in my
and-
head that I should have referred and I didn't
Yeah.
recently.
Yeah, and I
kind of got
understand
out of
it's
the
hard.
practice of doing it. I don't
Yeah.
know why.
And I know
But,
that
like, once they call me,
Don't we have these?
Yeah.
We have a stack of these.
Like I have a patient that calls me, his wife calls every week about specific behaviors and I don't have ideas, like showering and stuff, I try.
You're such a good guy.
No, I just talk to him. It's just like, I feel like I just talk to him. I don't do anything. I don't know
But see,
what
that's
to
where we
do.
could help you.
Yeah, I don't know how to get the guy to take his medicine.
Well, and you know what I had one doctor, she was like, Kim, I have a patient in my office right now here. And she passed the phone to the patient and then talked. Yeah. So that was a good, good handoff too. Whatever works for you. And yes, I'll push to get it onto the app. I don't know if that'll help with these.
Be awesome.
Putting it on the app.
But I know we're working with one hospital. It's in the packet. It's Alzheimer's disease Pocketcard. Just the last page in there.
Research Alzheimer's Association, well, at least on my person that pops up.
That's called Alzheimer's disease Pocketcard.
You don't find it in there?
Is it here? That was my bad.
There's a picture of it. On one of the
Do you have an extra packet?
I do. That'd be fine. I knew no one would sit up front, so I put them up there anyway.
She's talking about the pocket.
That's the last page.
Yes, the last, it's the last page, the second to last page.
Thank you, Kim.
Well, thank you very much. I had to pack some of them, so I volunteered to
Sure.
I made them, sorry. So call us if you ever need anything, send your patients to us, we'll take care of it.
Yeah, no.
I know you will.
Anybody thinking in the families as well.
And we're giving awards away to the top performers at the St. Louis. Yeah.
Yeah, absolutely.
Nice to work there.
Yeah, and I can, yeah, definitely.
So who should I give these? One head Yeah, we should probably. Yeah, I think we talked about was it you and I that were trying to call each other back and forth?
Yeah,
last year?
actually,
Don't have it All right. Great meeting you. They're gonna make more free, the intro.
sorry, go ahead. No, go ahead.